Thank you. I'm going to talk about the right to die with dignity. Dr. Kevorkian said, every person shall have the right to die with dignity. The right shall include the right to choose the time of one's death to receive medical and pharmaceutical assistance to die painlessly. We've all had loved ones or known someone who had a terminally ill loved one who has suffered through their anguish, through their agony, until their time of life was up. Someone who has lost a loved one to a terminal disease, watching them suffer and waste away in agony while the pain medicine is no longer working, is both heart-wrenching to the person and for the family and loved ones that have to watch them. Dr. Peter Goodwin didn't want to see people suffer anymore. From a terminal illness. Dr. Peter Goodwin, a Portland physician who campaigned for an Oregon state law that allows patients with a terminal condition to end their lives, died Sunday after using lethal chemicals obtained under the act that he championed. He died in March of 2012. He was 83 years old. Years earlier, campaigning for an Oregon assisted suicide law, he talked publicly about what he would do if he received a terminal diagnosis. Goodwin was diagnosed in 2006 with a rare brain disorder that progressively robbed him of his movement. By January of 2012, his doctors gave him less than a 6-month notice to live. Goodwin stated, "I don't want to go out in a whimper. I want to say goodbye to my family and friends." And I would end it. And that's what he just did. The medicine that he took was a fast-acting barbiturate. It gave Goodwin a peaceful death in less than 30 minutes. According to the advocacy group Compassion and Choices, which announced Goodwin's death in March of 2012. Under the Oregon law known as the Death with Dignity Act, doctors can prescribe medication to hasten the death of a terminally ill patient with a 6-month prognosis. The Death with Dignity Act was passed on October 27, 1997. Oregon enacted the Death with Dignity Act, which allows terminally ill people to end their lives through the voluntary self-administration of lethal medications expressly prescribed by a physician for them to use. The Oregon Death with Dignity Act requires the Oregon Health Authority to collect information about the patients and physicians who participate in the Act and publish an annual statistical report. As of February 29, 2012, prescriptions for lethal medications were written for 114 people during 2011 and for 97 people in 2010. Death with Dignity Act has requirements. They need to request a prescription for lethal medications. The DWDA requires that a patient must be of at least 18 years of age, a resident of Oregon, capable, defined as able to make and communicate decisions of their own, and diagnosed with a terminal illness that has a prognosis of 6 months to live. Patients meeting these requirements are eligible to request a prescription for lethal medication from a licensed Oregon physician. To receive a prescription for lethal medication, the following steps must be fulfilled. The patient must make 2 oral requests to his or her physician, separated by at least 15 days. The patient must provide a written request to his or her physician, signed in the witness of 2 witnesses. The prescribing physician and a consulting physician must confirm the diagnosis and prognosis. Politicians or the church do not have any right to decide on whether a person has a right to die or not. It should be left to the individual, the family, and the doctor. People, and not legislature, should have the choice to the options to die with dignity when they have a terminal illness. To keep people alive and suffering when they don't want to continue living is an act against humanity. To question someone's beliefs in how and when they want to die shouldn't be a state or federal regulation or law. A 2005 Supreme Court ruling upheld Oregon's assistant physician suicide law. The law has done more good than harm because it forced end-of-life discussions to come sooner and patients be more prepared. The terminally ill have the right to make decisions to die with dignity when medical intervention and treatment no longer sustains their ability to live in comfort. Oregon and Washington have made the progressive movements to allow physician-assisted suicide that are painless with the Death with Dignity Acts. These people want their privacy, dignity, and respect with their choices of physician-assisted suicide and the choices of the end of their life care. Thank you so much.